Welcome to the Appalachian Wellness Connection. Join myself, Dr. Kevin Britt, and my good friend Dr. Micheal Bryan as we guide you through natural solutions for better health and lasting wellness. From chiropractic care to functional healing, we're connecting you to the best in holistic health from the heart of East Tennessee. Okay, so today we are going to be exploring shockwave therapy. And shockwave therapy is a cutting-edge treatment that we offer here at Integral Wellness Company. And it's for anyone who's dealing with chronic pain, musculoskeletal pain, soft tissue injuries. This episode is definitely going to be something that you want to listen to, because we're going to unpack how shockwave therapy works and how it really benefits our patients. And so when we're talking about shockwave therapy, we're just talking about another non-invasive treatment that we use at the office, because we're constantly trying to be on the cutting edge of ways that we can help our patients, obviously without the use of drugs and surgery. And when we are looking for that, shockwave just fit perfectly for what we're looking for our patients. So people who were coming in and doing great for different conditions, but they still had a nagging issue, or they had previous soft tissue injuries and they were getting better, but they just weren't getting better to the point that we wanted them. Shockwave has come in and really been beneficial for those people. And so we wanted to highlight that on this podcast and really show how it works alongside all of the other holistic approaches that we have here, like things like chiropractic care, functional medicine, low-level laser, and everything else. So we're going to talk about exactly what shockwave is, how it helps, and what it can do for you.
Yeah, so to understand shockwave, I think it's important to go back to the history and see where shockwave originated. So this is not anything that's new. Essentially, shockwave came from the procedure called lithotripsy. So a lithotripsy, if someone has a kidney stone, is the process of basically breaking up that stone. So they would use high energy sound waves to pulverize those stones when they might have been too big to kind of pass through, the normal route. And so what doctors started noticing when they were using these lithotripsy type procedures is that if someone had degeneration, like in their hip, or they had osteoporosis, the physical impact of those sound waves actually made the bones stronger, and it actually cleaned up some of the arthritis. So naturally, curiosity set in, and they started looking at the effects of other tissues with shock waves. A lot of the next part of the process, they really dialed back the energy levels and used a lot lower energy. And they started noticing that lower energies were really good for cellular regeneration. More your higher energy was more for pain and breaking up adhesions and breaking up scar tissue. And then obviously really high energy, you could really irritate and break down, pretty hard substances like, stones and things like that. And so when we look at the mechanisms of action for shockwave, the important thing here is a shockwave is defined as a really high pressure sound wave. So if we imagine a chart as an example, a shock wave has a very high amplitude, so it's really quick, it's really powerful, and then it drops down and resets, for example. And so a shock wave, if we look at when we have like a bottle of champagne and we push on that cork and it makes that popping sound, that's an example of a shock wave. It's a really quick burst of sound, essentially. And so when we're pumping sound into the body, that's going through essentially at the speed of sound, which is several hundred miles an hour. That sound is penetrating through whatever tissue we're trying to work on. And what it does is it causes a very small amount of irritation. And because it gently irritates the tissues, that causes the body to go through the steps of recovery. And so that's where we really see its magic. And because it's a micro amount of damage, it's very, very small, you could almost in some sense think about it as really no damage at all, just enough irritation to start the healing process. And that's really the problem with chronic issues is that the body sees that as chronic, and when we use Shockwave, we're almost bringing that injury back to the forefront. Your body thinks it's more of an acute issue, and it goes through the steps of healing. So if we imagine a manual, and that manual has 100 pages, and each page has one step in the healing process, what Shockwave really does is it restarts everything back to page one and essentially goes through the process. Because a lot of times with the chronic issues, we get stuck in that process ultimately. And so some of the things that we have observed when we look at Shockwave is things like stem cell migration. So part of a healing response requires stem cells. And so stem cells get a lot of notoriety around regeneration. So if you have arthritis or degeneration in the knees, the back, the shoulders, different providers will inject those stem cells into those joints to try to regenerate those tissues. Now, if we go back to that manual that has 100 pages, the stem cell aspect is going to be, after page 50. It's going to be kind of more on the back end. There's a lot of small cellular things that are going to happen, in stage 1, 2, 3, in those pages essentially. And so Shockwave, we think, is a really good precursor to everything because it starts us back at page 1. Now, if we transition into some of the conditions that Shockwave is really good at treating, we can break this down into several different types. So if we look at soft tissue, one of the things that we see a lot of are tendon issues and muscle issues. And so we see a lot of degenerative processes in the spine in our office. And so a lot of times, if you imagine somebody's got degeneration in the neck, we know that those neck nerves ultimately go down into the arm. They innervate the shoulders, muscles around it, that kind of thing. We'll oftentimes find a lot of trigger points and soft tissue damage in those shoulders as well because that nerve supply has been altered for, maybe 10, 15, 20 years, and that's ultimately going to cause chronic muscle issues and chronic tendon issues. And so sometimes just adjusting the spine, opening up that brain to shoulder connection, that's certainly going to help. Sometimes you have to go in there and really work on that chronic issue because maybe the adjustment is not enough to necessarily help those appendicular type issues like in the knees, hips, shoulders, that kind of thing. So if we look at trigger points, for example, we'll talk about later on here in a minute. Trigger points are one of those things that are oftentimes overlaid into other issues. And so we alluded to earlier, we could have degeneration in the neck, we could have a bunch of trigger points in the shoulder, and oftentimes trigger points are misdiagnosed oftentimes too because you could have a problem in one area and it kind of show up in a slightly different way or a slightly different area. The pattern's a little bit different, so oftentimes they get misunderstood and misdiagnosed is a good way to think about that. And so breaking down those trigger points is oftentimes, for the majority of people, a major catalyst to get them to the next step in that healing response ultimately. And we see this a lot. We use Shockwave kind of in the middle part of people's plans. We adjust their spine and shoulders and things like that, whatever we need to do. But if we still see some things lingering, oftentimes we'll bring that Shockwave device in, and that'll catapult them into the next phase of their healing journey. Now, if we look at maybe the approach of where Shockwave is used in like orthopedic clinics and clinics outside of ours, oftentimes muscle strains and ligamentous and muscle sprains and strains oftentimes the process can be sped up. That recovery process, the window can be shortened, so it can be healed quicker. So Shockwave is oftentimes used in athletics as well. We know that the majority of sports teams, whether it's NBA, NFL, Major League Baseball, the majority of these teams will have a Shockwave device at their facilities essentially because that's one of the major players that actually use it. One of the things that we can use Shockwave on in the literature that they use Shockwave on is bone issues. So fractures and non-union fractures. So a non-union fracture oftentimes is when someone breaks a bone, and that fracture, it has to be surgically repaired, but it's so bad that they can repair it, but the two bones are not necessarily touching. There's maybe a rod or a screw that's kind of connecting, and there's a space in between, and that's what we mean by non-union. It's just the bones are not together. Well, there's a lot of good evidence of using Shockwave in these situations, because you can irritate the bone on both sides, and that irritation causes the bone to grow, and it can actually fill in that void or fill in that space. There's a lot of really good research on fractures and things like that. That's not something that we're going to do a lot of in the office and things like that. We had a patient in here the other day that has a weird phenomenon, neurological condition called CRPS, which is chronic regional pain syndrome. It's a really poorly understood disease, a lot of neurological complications and things like that. Essentially, most of these people feel like maybe a body part's constantly on fire and things like that. And there's a lot of interesting research emerging about using Shockwave in those types of settings as well.
Yeah, and I wanted to touch on what Dr. Mike was just talking about earlier with stem cells. And, in being chiropractors, we meet a lot of people who have knee issues, shoulder issues, and they'll ask about stem cells, or they will have previous experience with stem cells, and mainly stem cell injections from their medical doctor and orthopedist. And some of them have good outcomes and some of them don't. And that, initially wouldn't really make sense. Like, well, you're putting in these cells that should turn into whatever tissue you want them to be. And a lot of times those stem cells, and what we see in the research from shockwave therapy, is that those stem cells are going to follow the pattern of what the body thinks it needs. And if they're going into a stressful environment, if they're going into a stressed out joint that's not functioning properly, that has a ton of scar tissue already in there, they're just going to mimic that tissue, and they're going to essentially become another tough, non-pliable type of tissue. But if we can break up the scar tissue and the adhesions in there with something like Shockwave, and then introduce stem cells, then those stem cells are going to be forming in a less stressful environment, and it'll become a much more functional, much more pliable tissue that the joint actually wants. And the beauty of Shockwave is that it does both of those. It breaks the tissue, the scar tissue up and the adhesions, and then it stimulates your body's own stem cell migration. So instead of just injecting stem cells into a stressed out environment that turn into more scar tissue, which we tend to see a lot now in the research, we're creating a better environment first, and then the stem cells come in later. And that's why shockwave therapy is showing really, really, really good results in situations like that. And so when we get into the world of shockwave, there's a bunch of different devices, a bunch of different approaches. And the one we went with is a device called the Piezowave. And so the Piezowave is unique because it creates the shockwave, it creates the sound wave using what are called piezoelectric crystals. And these crystals are unique in this world because we're not using, let's just say it this way, they're more stable. And so we can get a lot more out of the device than some of the other devices out there, because a lot of the other devices, you have to constantly replace pieces of the machine, the head of the machine. You have to fairly regularly have to buy new ones, and they're not cheap. And so by getting a device that is far more durable, and we don't need to constantly be putting more and more and more money into it, it ends up making it more financially achievable for most patients. So that was one of the reasons we went with it, just from a cost perspective. But the piezoelectric technology also helps us ensure more of a consistent energy delivery, so we can have a more effective session for that therapy. And it can actually help, since it's more effective, we can help reduce the discomfort, and we can make the treatment more tolerable. Because when we are breaking up those adhesions, it can get a little uncomfortable. But using the piezo system, we can make it as comfortable as possible, if that makes sense. And so when someone comes in for a new treatment, we want to do first what's called a mapping session, because we want to figure out where they are, where we need to focus on, how much energy they can handle, and we need to put together a good plan for them instead of just wailing away on them and trying to do as much as we can initially. We want to work with the body, not against it, in everything that we do, and Shockwave is no different. But then once we get that mapping session done, we can put together a really good plan for people. And the average session is probably about 15, maybe 30 minutes, depending on what condition we're working on and how much work they really need in the area. So what you can expect while under the treatment, during a treatment, is you may have some mild discomfort because there can be like a tapping sensation during the procedure. You'll hear the noise, and we can adjust the intensity to go up or down in the middle of the treatment. So we can say, how does that feel? And someone can say, oh, it's, I don't feel anything at all. And we can increase the energy until they start to feel it. And then we know we're getting the desired outcome that we want. And then sometimes as we're moving along the area, they can just feel a quick jolt because we're onto an area that has more adhesions or more scar tissue, or we can sometimes get over a nerve or a bone. And so we want to be able to have that feedback right away, and then we can lower the energy when necessary. And then after the treatment, a lot of times we hear about mild soreness, up to a couple of days maybe, because again, we broke up those adhesions and the body's trying to work on that. Like Dr. Mike said, we're resetting the healing process back to day one. Think of a sprained ankle, that's day one of the healing process. And it doesn't ever get that extreme. We don't see swelling or inflammation or anything like that, but there can be some soreness that goes on with that. Just a quick aside, when our first seminar that we went to, when we got this device, I was just asking the doc who was leading the seminar about a specific condition. He said, well, why don't you just lie down and I'll show you how I do it. And so he started working on me, and I didn't have any issues in that area, but little did I know, as he started, I started feeling that sensation. He goes, oh, you must have some scar tissue in that area. And so he kept working on it, and I was like, okay, we're all done. And then the next morning when we were walking back to the airport, I had a really sore ankle. And so I've experienced that soreness that you can have, and it's minor, it's not extreme, but you can definitely have some soreness afterwards. And one thing I forgot to mention specifically about the Piezowave over some of the others is we actually have two different applicator heads. So we can treat more conditions and areas more specifically, because we have one that's a focused applicator head that can really hone in on areas, and then we have one that's called linear that gives us a much wider treatment area, so we can cover more space quicker than a lot of those other Shockwave devices that are out there. So we have improved precision, improved control, we can help improve the patient's comfort, and we can have a lot more versatility with the Piezowave over the other devices out there.
Yeah, so when we go back and look at the soreness that someone would experience, I think it's important for our listeners to understand that this is by design. And the reason I say that is when we injure ourselves, or we start a new routine, or really it doesn't matter what, one of the first phases that we have to go through is the acute phase. And that acute phase is called the inflammatory phase. And so the inflammatory phase in the healing process is where the body is going to send more blood flow to an area to give that area more oxygen, more nutrients, more of the building blocks that tissue needs. So if you imagine, let's just say you worked out your whole life, you go change up your routine, the next day, the day after that, oftentimes you'll get sore. And that the reason for that is because it's a normal physiological process that your body is going through that acute phase, that inflammatory phase. So if you do not go through that inflammatory phase, your body can't heal and recover the way it was designed to. So I think it's important, to understand that soreness is not a side effect that we don't want. It's actually something that we do want, because that shows us that acute phase is taking place. I want to go back and explain a little bit of the physics of sound, and this will help you guys understand how some of the mechanisms are going to work. So if we look at the physics of sound, we know that sound actually travels faster through more dense objects. Let me give you an example. If we talk to somebody, or we make a sound, and that sound travels through air, it travels at a much slower speed than if we make that same sound in water. And that's why we can record sounds underwater from miles and miles away, is because that sound travels faster and more effortlessly through denser material. And so if we contrast normal tissue and scar tissue, we get this shearing motion. Imagine that this sound wave is traveling through the muscles. It's traveling. We hit scar tissue and it speeds up real quick. It breaks through that scar tissue and goes back to muscle. It's going to go slower, faster, slower. And in that transition, that creates a shear. And that shear is ultimately where that micro amount of trauma is going to come from. And the body recognizes that scar tissue and says, hey, you're not supposed to be there. Then it starts the process of bringing in the immune system, and then the immune system can actually go in there and actually start breaking down those, the scar tissue. And even I've got some really cool images that they used on mice, because it's easier to look at and things like that when you have a control and then a treatment group. And so you can clearly see the difference of the treated versus the not treated group when you look at a 90-day window. The rats that have arthritis, it's real roughed up. It looks like a lot of sharp points. It's very jagged. And then when you contrast that to the group with the Shockwave, you can actually see that it's a good bit smoother, but then it's also a different color, meaning, for an example, in the knee, we know there's supposed to be cartilage on the ends of the bone, the caps and things like that. And we can actually see after, say, 90 days, 120 days, that those stem cells come in there and they actually start building up the cartilage that was rubbed off on those mouse studies, which is really, really cool. Shockwave really gets a lot of its notoriety around this aspect because so many consumers are really looking for ways that they can regenerate their bodies. And most of the consumers want to regenerate their bodies in the most non-invasive ways, right? An orthopedic's going to, quote unquote, regenerate the knee by, replacing that knee joint, put something artificial, versus, what we want to focus on is there a strategy that we could incorporate to allow your own body to get in there and repair some of that damage and some of that arthritis and some of that scar tissue and move in the direction of regeneration non-invasively, which is really, really cool. I want to share with you maybe just some practical examples and patient stories that we see in the office quite a bit. We alluded to, oftentimes we use shockwaves on more of our chronic patients. Sometimes if someone comes in and they've only got a really specific issue in a muscle, or they're an athlete and they irritate a tendon, maybe we just make a plan using shockwave there. But oftentimes we use it with our chronic patients kind of in that middle part of care. And so I want to share with you, just some stories of this week and some of the observations we've made. We've had several patients that have really chronic neck issues, and we know that the neck issues feed the shoulder. So people who have neck issues almost always have some level of shoulder issues, especially people like contractors that swing hammers and rip drywall and lift a bunch of heavy stones and stack things, and it's a more physically demanding job in regards to the shoulders. And so we had a patient, he's done really well with a chiropractic. He's doing actually really, really well. But he's still got this lingering, dull, like shoulder issues that he's had. And we've done around 4 or 5 shockwave sessions so far, and he's made some serious leaps and bounds to get to that next level. And so he's super excited because someone who does a real physical job understands that I may not be able to do this forever, And when that's your source of income, you want to be able to do that job as long as you possibly can and get the most longevity out of your career, because that's where you make your living ultimately. And so I think some really cool eye-opening experience for this guy, seeing that, man, I'm going to be able to be healthy a much longer period of time, than I thought, originally after doing this. And so, what's really cool about Shockwave a lot of times is the majority of people do really well with it, and it's one of the number one referral sources too, because this is a type therapy. A lot of clinicians that I know, they call it their magic machine, and ultimately they use Shockwave when they've tried everything else too. And the example of, you know who I'm talking about, young girl, ankle and foot issue and things like that. Man, we tried everything for this girl. We're like the fourth or fifth provider they've been to. They've been to orthos. This poor girl, she's probably 12, 13. I mean, she's pretty young.
Older than that, but we don't
Okay,
have to say
cool.
her actual age.
Yeah, whatever. So, and so she's been to different, orthos and just all over the place, the whole gamut. And nobody's been able to figure this out. And man, we were really struggling too, because we were doing everything. And we helped a little bit, but the main issue was still there. And we started incorporating some Shockwave, and we think that, we broke up some adhesions in those muscles enough that we were actually able to get, a bone in her foot, her navicular and cuboid bone, to actually move. And we tried to adjust that before with not a lot of success, but we broke some of that scar tissue down in those muscles that attach to those bones and got those muscles almost, think about it, like transformed, or they're healthier. And so we're able to get some really good motion into that bone, and she's made some really, really good progress in her care. And so, Shockwave is a really great catch-all to some degree. When someone's doing well, but they're still struggling with a unique issue, oftentimes you can bring that Shockwave in. So if you're that listener that says, man, I've got these soft tissue things going on, I've got these issues in my muscles, I've tried everything, I've tried working out, like I do massages all the time, and they help me a little bit, but they don't really fix the underlying issue. Or you've been to multiple orthopedists and they don't really have a lot of options for you, I'd encourage you to schedule a mapping session. So a mapping session does two things. It lets you experience what Shockwave can do and what the experience would be like, but it also is diagnostic for us, where we can evaluate you and see if we think it's going to be a good fit, because we can use this in a diagnostic fashion. And so it's a great option if you tried a lot of different things and didn't have that success with other options. So the takeaway, I'd encourage you, schedule a mapping session with your provider. Try Shockwave. It's a great add-on if you've had chronic issues in the past.